Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHIL, the Civic Health Innovation Labs.
CHIL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHIL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as, what are their day-to-day tasks? How did they get into the role that they currently have? And what advice would they give if you are interested in getting into this area of work yourself?
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City Region. Hi everyone, welcome to Health Data Decoded. My name is Samuel Ball.
And I'm Ed Hill.
So today we're joined by Claire Smith and Emma Lowe.
Hi. Hi.
And so in previous episodes, we've heard a lot about various different research projects that occur and take place through the Civic Health Innovation Labs, CHIL. And so on today's episode, with thanks to Claire and Emma for joining us, we're going to be discussing program management and managing partnerships. And so with both your roles, you have program manager and experience and expertise. And so just initially, if someone approached you to ask you about, a program manager, what is that? What do you do? And how would you describe your role to others?
That's a very good question. And I think it's one that Emma and I always kind of have a little bit of a laugh about, because we kind of actually say, our role is almost just to make things happen. So I guess in terms of putting that into a little bit of context, so I lead the research and partnerships across CHIL, Civic Health Innovation Labs, and I guess sort of my role at a high level is to make CHIL's vision happen at an operational level, and make sure that our kind of projects and programmes run to time and budget, have impact, are connecting with the right people. So I think there's a lot of activities that come within a programme manager or a kind of role across those programmes, but I think fundamentally it is about connecting people and delivering the research in an impactful way, managing that process to make sure that different teams, because we work across teams from, as I'm sure listeners are aware from previous podcasts, but we work with teams across the NHS, with industry, with other civic organisations like councils, etc. And quite often they will come to research projects with perhaps different objectives and vision. And I think a lot of that kind of programme management role is translating that into, okay, so what do we all want to get out of this and how do we do that? And how do we do that within the sort of parameters that we've been given in terms of the funder and the objectives and the time frame, for example. So it's a really interesting role because we sit at the interface of a lot of different things. I don't know, Emma, if you want to add anything to that.
Maybe just to add like some of the, I guess, the specifics about that role around, in some ways we almost operate like a mini sort of mini university within the centre. So, that sort of expertise around things like HR processes, finance processes, support that the teams might need engaging with the research support office and developing grant applications. Not that we necessarily have specific expertise in contracts, but we might know which type of contract and definitely who to talk to. So I guess it's helping the academics that work within the centre to navigate all of those processes and make sure that we're doing things in a way that both work for the funders that fund our research projects, but also that with alongside university processes to make that research happen. I think problem solving is a huge part of what we do, and I think we come along and it's that sort of making research happen. Is that we're often the first point of contact for risk management. We're the ones who are often the first to know about a potential risk, and are the ones that come up with the sort of solutions for how to kind of keep the research on track and keep things going while sort of making everybody happy. So a lot of it is really about having strong relationships with our partners and also with the internal teams in the university, and sort of the lots of people that also work in CHIL as well, sort of holding all those relationships together so that we can make the research happen.
Thank you for that overview, because that's just really showed the amount of different layers. So it's again not purely just the research team and perhaps the science aspect itself, to make it happen. So there's money there. So it's okay, what are the rules, constraints around that, the relevant people to talk to, and then the actual personnel, hiring, being able to get people on board. Risk that's something brilliant to bring up. You've got to think about risk and ethics and for all these projects. So the role you bring by getting the right people talking to each other to basically help these things happen is without it, basically the research itself can't actually function. This team science just wouldn't be able to take place. So this is so far, as we discussed with so many of these roles through our episodes, is without each of these roles, overall, we're not going to get anywhere.
Yeah, it's interesting, isn't it? Because at the moment now, science is we're in so many projects where it's one person's on one little bit and they work within their little section, and then another person's on a completely different bit, and sometimes those people don't talk to each other, and that becomes an issue. So it's having that glue that holds everyone together is so important. So I know both of you from loads of different projects, but could you tell our listeners what projects you both are involved with, and does your role differ from project to project, or is it kind of roughly the same across everything?
I think it does really differ across projects. I think, as you said, we work across so many, and then part of the fact is that the role that we have around that sits sort of as the CHIL part of the role, where we sort of have a role in understanding exactly what projects we have in CHIL and who's working on them, and that's very much part of it. So that might be the involvement that we have, is that we know who the staff are on that project, we know who the funder is, we sort of have that initial information. We might be helping with some of the data access, for example, on that particular project. And then there are projects where we are really deeply involved. So I think my colleague Emily Rempel came on and spoke about the Civic Data Cooperative, and for me that is probably the project that I'm the operational program manager for that project, and so that's the one where I'm really deeply involved in almost all aspects of what the Civic Data Cooperative is delivering. From sort of a financial perspective, but also very much from leading a team of project managers and working very closely with Emily and the director, and Ian Buchan, who's our centre director, to the day-to-day delivery of some of that project. So, for example, we've got a festival of data that we're delivering in a couple of weeks' time, and I'm very much involved in sort of the event management side of that, as managing the budgets, but also we'll be part of the delivery team of working with some of the school children that we're bringing in, and also then speaking at the conference too. So yeah, it really does differ, and I think it depends on the size and scale of the project too. Obviously the CDC is a very big program. We've had smaller programs where I might just have been involved in just making sure that the contracts, for example, get over the line, and the academics have the sort of everything on the systems that they need.
Yeah, thanks, Emma. And I think I guess to build on that, my role is probably slightly different in that it sits sort of across all of the programmes in CHIL. So as Emma said, we do have a kind of role in that kind of oversight across all of the programmes. And actually, I think really importantly, since CHIL was established as a research centre, that's the role that I and Emma plays in that, having that oversight and really bringing the programmes together as what almost kind of one programme of work, looking at those areas within programmes where, oh, you're doing something similar there. How can we bring that together so we're not duplicating, we're sharing expertise, we're sharing best practice. And we do a lot of that at our CHIL project management office that we meet monthly, and we'll kind of report in on the different kind of projects and programs and look at kind of areas that we could focus on. For example, we had a focus recently on impact. How are we drawing out impact case studies? How can we do that across CHIL? So there's definitely that piece, but then, as Emma said, we do then get involved in particular projects and programs, again depending on the size and the kind of resource needed. So for example, at the moment I do have an operational oversight role in the Emric programme, which I know again has been mentioned on the podcast previously. You had Jenny Garden on, who's fantastic. So I kind of from the university side lead the operational oversight within Emric. So there's a lot of activity there in terms of there's lots of individual even projects within that huge programme of work. We've got activities relating to, clinical trials, bringing in kind of testing new medicines, new devices. And then there's a big piece of work in terms of bringing together the reporting for that and how we feed that in, because we're part of a much bigger network with Emric. We're a demonstrator site within the wider kind of a national mission. So we have objectives in terms of working across that mission and coordinating that, coordinating the other programme managers and sort of clinical trial programme managers as well. So we do kind of have that in-depth role and then that almost sort of oversight role as well, depending on the project and programme.
So, and remarking about actually the reporting aspect, so again it's like actually just being able to make the research happen in the first place, but then making sure it can continue and then again adhering to funders' requirements or university requirements, etc., making sure the reporting elements are being kept track of and everything is then. If audited is in place and there, so that's another very vital part of the role for sure. And so CHIL itself, I guess, still very much in its early years. So from your own perspectives, how did it come about, your involvement with CHIL and then your own basic journeys into the kind of project or program management type roles you currently have?
Wow. Well, I guess I'll start with my journey because I guess it feeds into the formation of CHIL, if that's okay.
Yeah.
So I guess started 20 years ago. So my background, I don't have a background in kind of data science or health data at all. I was a biochemist, did a kind of PhD in cell signalling mechanisms in wound healing. And then, I want to say about 18 years ago now, after PhD and a postdoc, I kind of moved into the kind of research project management space, and that was within kind of health data project, and I guess grown since then. So that was at the University of Manchester, and I was there for a number of years delivering, I guess, increasingly kind of larger and more complex health data projects and programs. And then that led to the move to Liverpool about 4 years ago, and I actually moved to be the program manager on the Civic Data Cooperative Emma referenced earlier, working with Ian and Gary, kind of building off the back of all the brilliant work that had sort of happened during the COVID pandemic in Liverpool around kind of, using really innovative kind of teamwork, I guess, in that space to really drive, what you could do with data in real time. And the Civic Data Cooperative was obviously kind of developing off the back of that as well. So I came to work on that project, which is still ongoing and is fantastic. And then I guess really CHIL was sort of born out of some of the work. So, during that first couple of years, the team was growing. I was involved in the development of a number of grant applications, including Emric and others, and we were really kind of building momentum in the team in terms of kind of the work that we were doing, the grants that we had, the partnership working locally in terms of the NHS trusts with our local sort of ICB, with civic organisations. And it was just kind of really came to the fore then, well, actually we need a structure to bring all of this together in terms of how we govern something that big, but also just how we kind of accelerate and grow some of that within the university. So I guess CHIL was born as a kind of research centre of excellence out of that work, and also having the physical space. So we had the opportunity to move into the lovely building that we're in today, which also gives us that ability to kind of have hosts, our partners as well, so they work there with us. So I think it was the culmination of kind of almost having that structure and the physical space together that kind of CHIL was born, and we launched in December 23.
My journey is, I guess, a little bit different. I worked at Edge Hill University in widening participation and the international office. So I work very much. My interest has always been around, doing something that I feel has a positive impact on society. And so I worked in widening participation, but then I actually moved to Hong Kong. There was some changes to funding, and I decided it was an opportunity to move to Hong Kong because that's actually where I grew up, and I wanted to kind of go back and experience what it was like to live there. And I spent 7 years teaching.
Wow.
So I taught high school, not science. I taught history and theory of knowledge, which is a little bit like philosophy. But then we came back to the UK just before sort of the COVID lockdowns. And I then pursued some further education myself. And I then went back to a role in widening participation, but at that sort of project management level. I worked on a project that was working with schools across Manchester, Manchester Metropolitan University, on a project that had a lot of partnerships. I think we had 11 different partners, and an annual budget of over £2 million. So that sort of project management transferable skills then became very applicable when I was looking for roles within Liverpool. I live much closer to here than I do to Manchester, and so I was looking for something that was sort of closer to home, but still had that ability to have a positive impact on society. And I actually applied to be the project manager of the Dynerics project, which is all about using AI to find better ways of identifying people with problematic combinations of medicines, so that they can be brought in for structured medication reviews and sort of help with identifying patients who have that problematic polypharmacy aspect to themselves. That very much resonated with me because at the time my grandma would be very much one of those patients. And so I applied to be the project manager of Dynerics, which has a number of different university partners, the University of Glasgow, the University of Manchester, University of Leeds, and also NHS partners with Merseycare and Powys Teaching Health Board. So that sort of partnerships experience that I'd had from working with other university partners in Manchester was then very much applicable to that role within Dynerics. And then I worked with Claire on the launch of CHIL. We were very lucky that we had various members of the high level members of the NIHR and also many of our publics who came to the launch of CHIL. And so we worked on an event together, and then an opportunity came up to support Claire with more of the sort of partnerships working and the grant applications.
Yeah. Wow, it's really interesting, isn't it? The journeys to get into different roles. I think we're always surprised when people come on, and we always learn something about people's backgrounds as to how they move from a PhD or something else kind of into a project management role, and they kind of work their way to CHIL and other things.
I always find that immense, and the fact that really then highlights the different perspectives that we then get across the team, that life experience, individual life experience everyone can offer, which then just helps broaden everyone's horizons, essentially. Yeah. It's brilliant.
Sorry, go on.
Yeah, I was just going to say, I loved earlier, Ed, that you used the word the team science model, because I think that is kind of the model for CHIL in terms of, and I think not completely unique, but I think in the university we kind of do live that model in terms of, as you say, the kind of the varied kind of roles and perspectives that we have in a team. And when you're kind of spinning up a team for a grant application or delivery, I think we do really have that breadth of knowledge and not that very traditional, just kind of academic postdoc structure. We have comms experts, we have public engagement, we have the project and program managers, we have lots of those different type of roles to bring those perspectives. And I think that makes our delivery kind of really inclusive but really effective as well.
It's funny, isn't it? Because the way that universities are structured is like you've got your different departments. You might have a department full of mathematicians and then a department full of clinicians. It's quite hard to get them to talk to each other, but one of the great things about CHIL is that you've got that real mix of different people, so that when you're doing the team science approach, you don't have to like organise between all those barriers of getting everyone together. They're just there in that one building. Yeah, it's also interesting as well because I think when I talk to some people, they kind of think that there's like a route one way to get into like clinical science or like AI or project management, and they say, oh, I'll go and do a project management degree at a university. And it's just not the case at all, because there's value in there's a massive amount of value in having like a PhD in a science field and then understanding the research framework to be able to deliver better project management in that kind of way. So that's really interesting. So I think we've talked about the kind of high level overview of the roles and how you got there. I think one of the interesting things to talk about is you come in the morning and you sit down with your coffee and you kind of get ready to get started. What does your day-to-day look like on the average day?
Well, this one's really difficult to answer just because actually one of the best things about our role is the fact that it's so varied, and that day to day differs so much, and even week to week differs so much. I mean, part of it is that some things are cyclical, so there are some things that will be determined by a cycle, so your reporting cycle, or where you are in terms of the finance processes that you might need to be in that week. So some things are cyclical, like some things will be routine. For example, on the CDC, every month we have a finance claim, and so there is a need to kind of do at least one of those weeks per month. There will be a sort of more finance focus to them, and then obviously in the run up to a reporting cycle, if that's quarterly, then that will help to dictate some of what your day looks like. But and I would say some things are the same. Generally there's a lot of meetings. We go and we're sort of a lot of that is about sort of tracking where the research is up to. Understanding where things are going, helping to put plans in place. You can't get away from the fact that a lot of it will be around writing emails and catching up with people and keeping on top of those. And a lot of our job does involve Excel as well, and sort of tracking what we're doing, where things are up to, and that side of things. But then there's also the really interesting part where we are going to workshops and events that people are putting on. Lots of the time we're very involved in public engagement as well. So it might also be you might be going to a sort of workshop with the public and sort of hearing their views and their sort of takes on things. And then equally you might also be invited to a lot of like high level academic meetings as well, sort of steering groups and program boards for the projects that we work on, and really hearing the sort of going into the detail of what the research is and what's been achieved. So it's really different. It's really difficult to say what a typical day looks like because it's sort of dictated by so many of those aspects of what you're doing and the projects that you're working on, and maybe the grant applications that you're supporting as well. So I guess the point being though is that it's a really interesting job because of that variety. And if you're somebody who does enjoy learning all these different things, you do get that opportunity by being a program manager.
Yeah, I agree with all of that, Emma, in terms of kind of how varied it is. I mean, I've kind of, when I was thinking about this, I thought, right, well, in a particular, even, morning or a day, I can go from a meeting about quite detailed around a mental health clinical trial that we're trying to implement to then bringing together a consortium for a kind of big grant application on AI, to then a meeting about office usage and health and safety, all in a kind of morning. So it is really varied. And I think, as Emma said, that's often the beauty of it, because you get to learn lots of different things. You get to be part of lots of different things. I think it helps with those project and program management kind of skills with managing those multiple kind of projects and deadlines and sort of themes, I guess. And I guess, got to be conscious of bringing all of those things together. But yeah, I mean, as Emma said, we had the CHIL launch that we sort of almost went into quite an intense period for a couple of months of almost it's like organising a big event, isn't it, in terms of like, thinking about the guests, thinking about the order of events, thinking about the space that you're in, thinking about the budget. And that's quite different even from thinking about how you pull a grant application together. So, you know, you do develop very different skills along the way, you know, with event management and things like that. And as, you know, Emma touched on as well, the team within CHIL, the project and programme management team, we do get involved and facilitate a lot of the public engagement. So then you might be meeting with service users and members of the public and having conversations or planning how we can get their input within, you know, a particular environment as well. So I guess, you know, no 2 days are the same really, but I think that's one of the things that I really love about the role, and I think lots of others in the team do as well.
From those who you interact with, so it's like covered there, you've got the funders, the institutional discussions, health agencies, the public. So just, I think, you portray across that the ability to actually communicate and do well at that, and that's changing like multiple times within the same day. I think that's actually, you probably don't get formal training, and that's just through experience. You just start to develop being able to do this efficiently and well. No, I think that's super awesome that you have the ability to be able to do that. That's great. And it makes me wonder, in terms of, so there's the events within the projects that you're part of and help oversee, that you help contribute to and help run. Are there other events, say, in terms of where you get to go and like talk about, as a project manager, program manager, your experience basically, and show CHIL as an example? So essentially, like the conference scene for program management, etc., and for training and mentoring. Is there anything on that side?
Yes, there is. So I think, you know, again, as maybe a designated program manager on a particular grant, you might go to events and be representing the kind of program at a particular conference, or, you know, an NHS event, or even kind of those almost big kind of citizen science like conference type, Blue Dot kind of festival type things. You know, you might be going there and kind of, you know, trying to have a role in communicating that research in quite a different and innovative way. So we definitely get involved in that, and Emma's got, I'm sure, lots of examples of that as well. I guess one thing that's really interesting that Emma and I went to last year was the ARMA conference, which I'm going to forget what the ARMA acronym stands for, but essentially it is a conference and a kind of collective for research programme managers. And that was really interesting because I guess you almost feel like you've met your people in that sense, that when you go there, that, you know, we do go to other research conferences and that's really interesting as well, but this was specifically around kind of, you know, those types of roles and how you can develop those roles, the sort of experience within those teams and developing those. And that was really, really interesting actually. And we've kind of been thinking about how we can do more of that in the future, but it's a challenge because it isn't typically something that, for example, would be costed into a research grant. So it's difficult, I think, for roles like ours to sometimes access some of those opportunities. But I think if you can, it's really, really beneficial. And there was lots that we kind of brought back from that in terms of ways to kind of think about impact and other types of kind of processes within a research environment. So yeah, that was really interesting.
Yeah, I think probably just to echo that, I mean, we do get opportunities to speak at conferences as part of this. I'm actually speaking at the Rewired conference in Birmingham, which is a really big NHS digital and data conference in March time. And I'm going to speak alongside some of our partner organisations from the Fire and Rescue Service and also from the NHS Data Interaction team. I think you had Andrea Asprey on the podcast. So, you know, that. And the idea really is to showcase the sort of civic partnership that we have in Liverpool and how we can do good work in that space. So we've actually been working with the fire service on developing a new way of risk stratification for how they conduct safe and well visits. So helping them to find a data-driven approach to properties where people have an increased vulnerability when it comes to either have causing an accidental dwelling fire in their home, or a risk of not being able to escape from the property because of health and lifestyle factors. So it's a really interesting opportunity to go and speak and really, that project from a university perspective, because it's very much about action. And so that's just one example of sort of conferences. And also, we as Claire says, we have put on a lot of our events. So oftentimes, even if we're maybe not the direct speaker, we might be the ones facilitating a session. We might be the ones sort of being the announcers at those conferences and helping things to flow. And I think particularly a role that we do play is around facilitation of workshops. Yep. So, we bring in our partners. Oftentimes we will help to develop the agenda, and we will just help sort of the flow of conversation, even though, we might ask one of our senior academic colleagues to sort of chair the meeting, but we will be very much involved in helping those discussions flow and capturing those discussions. I think the other thing in terms of mentoring, so I line manage a team of project managers, and I think you naturally become really involved in their projects and helping them to sort of find ways of problem solving. And certainly Claire has been a real mentor for me in that respect. So Claire is my line manager, for full disclosure, but also in terms of mentoring, she's been invaluable because she knows everything. So if you ever need a question answering, then you go to Claire and she's able to give you an approach to take, or she'll know who to talk to. And I do think that is very much a huge part of our role when it comes to mentoring, because even if we don't necessarily know the answer to it, we'll know how to guide our sort of project management colleagues or other colleagues to find those answers. And I think that's really important.
Yeah, it's interesting, isn't it? I think it is like the glue that holds everyone together, and it is almost the role that knows the most about a project, because you're sitting on top of all the different roles, and whereas I think as researchers we're probably a bit more siloed in how we think about projects sometimes, in that we're given a specific part of something to work on and then kind of squirrel away at it, and then we pass it on to someone else, and then we kind of wash our hands of it a bit, saying, I've done my bit kind of thing, and as long as that works, it's okay. I think one of the interesting things we always ask people is, so obviously everyone's got a different skill set when they come into the different roles, and everyone has to pick up different skills when they start learning the ropes and what's going on in the role. Are there any skills that you have learned while in your role that you didn't think might be needed or applicable? Like, what's one of the weirdest skills that you've had to pick up to do the job?
I don't know if there's necessarily skills that I didn't expect. I mean, I think probably the massive learning curve in an extent, because you come into a project, and I remember my first day on the Dynerics project, going to a project meeting and being asked to take the minutes, and I was a little bit bamboozled by all of the acronyms, and in terms of, I think probably it's that interpreting the science part that I didn't necessarily think would be part of my role. I didn't really necessarily, that communication aspect has been something that is huge, and I think it's only grown in importance, and I think people do understand the importance of being able to explain what you do, and often that is something, is a role that in some ways program or project managers have, is about helping the project to translate their research into something that the public can be aware of and involved in, and I do think that is perhaps something that I didn't necessarily anticipated. I think I anticipated that there would be learning curve in terms of, knowledge of budget and ethics and funding requirements. That those are all skills that I have gained, but I possibly expected that I would anyway. But I think that translational aspect is somewhere where a lot of project and program managers, because we're not necessarily subject experts in the way that academics are, and so we almost have to process our own understanding of what the project's all about, and that in many ways also helps us to then be able to explain it to other people.
Yeah,
I agree. I mean, I think I've got, thinking about this, it's the bridge, almost the bridge between different worlds, isn't it? Kind of being able to take those concepts. And I think one of the interesting things about where we sit in CHIL is that the data and that kind of infrastructure, it's an area of kind of research in itself, but often it's kind of a cross-cutter. So again, we can be involved in projects where, there's for example, mental health, but then we've got, antimicrobial resistance, or there might be a particular project on cancer. So there's that intersection as well between kind of, well, what are we trying to deliver here in terms of, the underlying kind of data element of it, but how does that fit in with some of the kind of biological mechanisms as well, which I found really interesting, again, kind of coming from that biochemistry sort of background. But I think there again is that translation piece. If you're responsible for trying to operationalise that, you're kind of trying to understand it across the piece and be able to explain it to those different stakeholders. I guess in terms of stuff that's weird and wonderful, I mean, I think for me, experience of things like estates and health and safety processes, not that it's all important and it's all part of running kind of a research centre, but I think, there's those bits that I perhaps never thought would quite be part of a role, and then you go from that to, as Emma said, quite specific things like knowledge of intellectual property and kind of regulation, and you build those along the way. But I think it's great that we do have an opportunity to get involved in some of those kind of a broad range of those different kind of elements of research, really.
And from the researcher standpoint, it's then being completely naive perhaps to certain IP aspects or health and safety and form sign off, etc. So this is where it's like, yes,
really helpful.
This is like super helpful. And just think about the meeting minutes, and yes, the page of acronyms is more than a page long. It's like, I think science, we like it. We like our acronyms.
Yeah, sometimes
overly so. It
do.
gets really ridiculous. And so to close, for those who might be interested in getting involved in kind of healthcare, data science related work, would there be a piece of advice you'd like to share with our listeners and viewers?
I would say absolutely do it if you're interested, and there's so many opportunities to do that. And I think, as we've kind of touched on earlier, in the conversation today, there isn't necessarily one route in, and it isn't linear. I think that, you can come at it bringing experience from so many different domains, but actually what's amazing about it is the sort of the impact that you can have as a team. And I think, speaking personally, I think that's what gets me up in the morning. It's kind of like, I want to be involved in something that really can make a difference in people's lives. And I think working in this space, you can really tangibly see that, even within the lifetime of, a research project. You can see the impact that it's having within, health and care. And I love that. And I think, particularly as well, we do within CHIL, as we've mentioned, a lot of kind of engagement with the local community and wider, and with service users. And so I think if you've got an opportunity to get involved from that perspective as well, I think that's really kind of rewarding and absolutely essential to the work that we do. So do it, and there's lots of kind of ways that you can be involved and make that contribution.
Yeah, I think just to echo that, I think obviously I detailed my sort of journey into this world, and it is quite atypical from, the path that perhaps a lot of people had taken. But I think that's important, that transferable skills are important. I think we've obviously highlighted the importance of, communication, attention to detail, being able to build relationships, being really valuable skills particularly for that team science approach. And I also wrote somewhere else in my notes about being the glue that hold things together. And I do see myself sort of in that space. I might not be able to necessarily explain how natural language processing works, but, I could tell you someone who does, or I could point you in the direction of somebody who does. And I think that's probably been... so I don't discount yourself, is what I'm saying, is that there are many different roles within research, and I think there are spaces for people who don't necessarily have that sort of hard data science background to still contribute in a meaningful way.
Definitely. Yeah, I think I'd agree with all that.
Definitely. The interest and keenness is paramount, isn't it?
I think even natural language processing people couldn't tell you how natural language processing works. But hey. Well, thanks, Emma and Claire. I think this has been an excellent episode. And thanks to the listeners. So if you like the episode, please subscribe on Spotify and on YouTube. And we'll see you next time for the next episode.